सस्ताया पाखे लसकुस कुछ त लसकुस हना बिना दिसे दुनुलो निसे लसकुस यान्छना सुभा ठुगो भिंगु जाया त न्ह्यने कया वने त आजी गुठिया मुछाङजी मेजु प्रेनिसा साके जुया त वेक या त थौ जाजो या न्ह्यने न्याका दि त ल लान्छना सुभा
जजलुपा सकलिसित थन चाइदि पिन सकल भाजु मेजु पिन त निप्रंसा साके पाखे अले जे पासा पुचा गुठी युके लन्डन ने पाखे युके को लस्कु स्यान्छना हामीसँग यहाँ जुममा उपस्थित भई हामीलाई साथ दिनुहुने सम्पूर्ण यहाँ आउनु भएको हाम्रो मेम्बरहरूलाई चाहिँ भित्री मनदेखि वेलकम भन्न हामीसँग फेसबुकमा पनि जोडिनु हुने सबैजनालाई वेलकम भन्न चाहन्छु। अब चाहिँ हामीले आफ्नो आजको कार्यक्रम जुन चाहिँ मेन्टल हेल्थ ड्युरिङ पेन्डेमिक छ जुन त्यो चाहिँ अघि बढाउन लागेको छु र यसको लागि चाहिँ हामीले विभिन्न क्वेसन्सहरू हुनुहुन्छ। तपाईहरुले चाहिँ हाम्रो डाक्टर निकी साकेजी जो चाहिँ साइकाइट्रिस्ट हुनुहुन्छ उहाँलाई सोध्न सक्नुहुन्छ। उहाँले चाहिँ आफ्नो पहिला प्रेजेन्टेसन दिनुहुन्छ, त्यसपछि चाहिँ तपाईहरुको क्वेसन्स वान बाइ वान तर एउटा एउटा मात्र क्वेसन सोधिदिनु होला। त्यो बेला चाहिँ है सबैलाई चान्स दिनु पर्यो हैन। यदि भन्दै मेरो दुई शब्द चाहिँ यही टुङ्ग्याउन चाहन्छु र साकेजीलाई चाहिँ यता उपस्थित हुनलाई चाहिँ निम्ताउन चाहन्छु। धन्यवाद। Nikki Shakya, please, over to you. I think.
जोजलपा सबैलाई यहाँ उपस्थित सबै ऑडियन्सहरुलाई मेरो भित्री मनदेखि जोजलपा। आजको यो एकदम नै समय सान्दर्भिक टपिक मेन्टल हेल्थ in the pandemic को बारेमा यो फोरम दिनुभयो, यहाँ आएर मेरो प्रेजेन्टेसन शेयर गर्ने जुन एउटा अपर्च्युनिटी दिनुभएछ पासा पुचा गुठी लाई धेरै धेरै धन्यवाद भन्न चाहन्छु। बिफोर आई स्टार्ट म पहिला मेरो यो प्रेजेन्टेसन स्लाइड एकचोटि शेयर गर्न ट्राई गर्छु। एकैछिन मसँग अलिकति धैर्य गर्नु होला। Okay. All right. Here it is. Slide देखिन्छ अहिले स्क्रिनमा?
हजुर, we can see it. हजुर।
Okay, so आजको मैले presentation English र नेपाली दुईटै मिक्स गरेर भन्ने छु so that I can reach out most of our audience present today. अनि मेरो लागि क्वेशन्सहरु अलरेडी इमेलको थ्रु आइसकेको छ। I have quite a few questions here in front of me. मेरो विचारमा आजको प्रेजेन्टेसनबाट पनि कतिवटा यो प्रश्नहरुको उत्तर भेटाउनु हुनेछ होला। तैपनि एन्ड अफ द प्रेजेन्टेसनमा अझै क्वेशन्सहरु छ भने प्लिज अगाडि राख्दिनु होला र म प्रयास गर्छु आजै त्यो क्वेशन्सहरुको आन्सर दिन। If not, you can always reach me through my email and I'm happy to share that with all of you. So before I start, I want to introduce myself. So I am a medical doctor by background. I've been working within NHS for the last 11 years and currently working in the capacity of a consultant psychiatrist in West London NHS Trust. Apart from professional work, I'm also mom to two beautiful children. You can see their pictures on the screen. So तपाईहरुले अहिले मिडियामा न्यूजमा सोशल नेटवर्क्सहरुमा इम्प्याक्ट अफ मेन्टल हेल्थ पेन्डेमिक इन द मेन्टल हेल्थ को बारेमा धेरै न्यूजहरु सुनि नै राख्नु भएको छ होला। तर आजको मेरो अब्जेक्टिभ तपाईहरुलाई मेन्टल हेल्थ को एउटा जनरल ओभरभ्यू दिने हो। त्यसमा मेरो मेन उद्देश्य के रहनेछ भन्दाखेरि कोभिड ले गर्दाखेरि मेन्टल हेल्थमा कतिको इम्प्याक्ट भएको छ। त्यसमध्येमा पनि हाई रिस्क पपुलेसन भनेर सर्टेन पपुलेसनमा र सर्टेन कोहोर्ट अफ पिपलमा कस्तो खाली इम्प्याक्ट देखिएको छ अनि हाउ आर वी एबल टु रेकग्नाइज सिम्पटम्स, कसरी लक्षणहरूलाई हामीले आइडेन्टिफाई गर्न सक्छौँ र कसरी यसलाई हामी म्यानेज गर्छौँ भन्ने कुरामा आज मेरो प्रेजेन्टेसनको मेन फोकस रहनेछ। सो मेन्टल हेल्थ भनेर भन्दाखेरि डिफ्रेन्ट एजेन्सिज डिफ्रेन्ट फोरम्सहरूले डिफ्रेन्ट तरिकाबाट एक्सप्लेन या डेफिनेसन भनौँ न होइन डिफाइन गर्न कोसिस गरेको छ। तर मेरो पर्सपेक्टिभबाट हेर्दाखेरि सिम्प्लिस्टिक भर्जनबाट हेर्दाखेरि what is mental health भन्दाखेरि mental health is a dynamic state of internal equilibrium. Equilibrium भन्दाखेरि balance. हामीले हेर्न खोजेको balance in 3 aspects of general well-being: emotional, psychological, or social. It has become very clear with this pandemic the importance of the equilibrium between or within these 3 aspects of well-being, and I will talk about that in more detail. So अब अलिकति स्ट्याट्स अलिकति नम्बर्सहरुमा हेरौँ है त। यो फर्स्ट जुन ग्राफ देखिराख्नु भएको छ, अझ यो भन्दा अगाडि म के भन्न चाहन्छु भन्दाखेरि अहिले धेरै साइन्टिस्टहरु फ्रम डिफरेन्ट ब्याकग्राउन्ड्स दे आर डुइङ अ लट अफ रिसर्च इन्टु कोभिड, यो पेन्डेमिक को बारेमा, स्पेशली द इम्प्याक्ट अफ कोभिड इन मेन्टल हेल्थ। त्यही भएर अहिले लङ टर्म इफेक्ट अफ यो कोभिड एक्ज्याक्टली के हुन्छ भन्ने कुरा एकदम क्लियरली भन्न सकेको छैन। तर अहिले मैले तपाईहरुलाई अलिकति यो जनरल ओभरभ्यू या एउटा स्न्यापशट जस्तो हिसाबले देखाउन खोजेको हो। यो फर्स्ट ग्राफमा तपाईले हेर्नुभयो भने what stands out? The red bar. If you see the red bar, all red bars in that screen, हुन्छ नि सबै, it's much higher, the stats are much higher, and this is a data of moderate to severe symptoms of depression in adult cohort. And you can see the percentage rise from 2019 to 2020. If you focus on the age group in particular, 16 to 39-year-old people, they're 3 times more likely to be affected than 70 and over. So you can see that is something which really stands out, and I will talk about that in more detail later on. Second graph, this is the statistics on mental health in children. So definitely, again, red bars are much bigger than the blue bars. And these, again, are mainly the probable mental health problems in children. And what really stands out is that girls within the age of 11 to 16 are much more affected at the moment, if you look at the numbers in comparison to 2017. Now, what are the drivers of mental health problems? So मैले अघि भनेको जस्तै जुन त्यो ब्यालेन्सको कुरा गरे नि, सोशल हैन, यो जुन हाम्रो इमोसनल साइकोलोजिकल र सोशल इम्प्याक्टको बारेमा, यसमा हेर्नुभयो भने जुन ब्लू बार्सहरु छ यसमा चाहिँ सरी त्यो नम्बर कलर कोअर्डिनेसन अलिकति यसमा फरक छ। यसमा ब्लू बारले चाहिँ मोडरेट डिप्रेसिभ सिम्पटम्सहरुको बारेमा देखाउँछ। द फर्स्ट 4 मै हेर्नुभयो भने अलरेडी त्यसमा साइकोलोजिकल इम्प्याक्ट जुन फिलिङ स्ट्रेस्ड, feeling worried about future prospects, feeling isolated. These are the main factors that are driving mental health problems at the moment. And your statistics say you have the Office of National Statistics. So let's just look at another study. You say Hamro University College London ko COVID-19 social study bara मैले निकालेको graph हो। अनि यो social study ले different aspects of mental disorders हरुको बारेमा चाहिँ कस्तो भइरहेछ ट्रेन्ड, what is it looking like भन्ने कुरा देखाउँछ। तर not to complicate it too much, मैले चाहिँ certain few aspects which are much more relevant for today's talk त्यसको बारेमा भन्दैछु। So first मा हाम्रो छ anxiety. Anxiety को बारेमा म पछि फेरि कुरा गर्नेछु, तर anxiety को तपाईले हेर्नुभयो भने यहाँ मेरो कर्सरलाई तपाईहरुले फलो गर्नुभयो भने जुन यो डट देख्नुहुन्छ, that is the pre-pandemic level of anxiety in different population groups. So you 5 bhanda muni cha, that's our pre-pandemic level. Our first lockdown, which was on the 23rd of March, you can see how anxiety levels have peaked significantly at that point. From that point onwards, the trend is going down progressively. And you can see there's some improvement as we approach second lockdown and then a dip again. And similar story with depression as well. So our pre-pandemic level has 5 bhanda muni, it's gone up, trends going down again, and it's going up again. So I'm just going to talk about those through anxiety and depression later as well. यो हाम्रो थर्ड ग्राफ चाहिँ लाइफ सेटिस्फ्याक्सनको बारेमा हो। तपाईहरुले प्री पेन्डेमिक लेभल देख्नुभयो भने 7 to above हामी यो लेभलमा थियौं भने हाम्रो अगेन very significant dip in the life satisfaction from first lockdown. There has been some improvement over the course of time, but again it looks like it's going down again with the second lockdown. So यो हाम्रो अलिकति हाम्रो यो स्टडीहरुको बारेमा भयो, statistics भयो. Now this slide is quite important and quite pertinent to our to my presentation today. So Mental Health Foundation ले एउटा research गरेको छ by the name of Mental Health in the Pandemic भनेर. अनि they have used a metaphor to say that we're all in the same storm but we're not in the same boat. यसको भनाइको अर्थ के भन्दाखेरि हामी सबैजना whole world is in the pandemic. तर यसमध्येमा पनि certain cohort of population भनौं न हामी सबैलाई एउटै किसिमले चाहिँ अफेक्ट भएको छैन. We have all been affected in a different way. यसमध्येमा मैले different categories हरुको बारेमा कुरा गर्छु. त्यसमध्येमा पनि 5 वटा यो अगाडि स्लाइड्समा देख्नुहुनेछ जसको बारेमा म अलि विस्तृतमा कुरा गर्नेछु. So the first category is children, 5 to 17 years old children. अब यो मेरो लागि पनि धेरै नै relevant छ because I have 2 children myself. Esma, if you look at the stats, in comparison 2017, 16% rise देखेको छ from 10.8% in 2020. So there has been definite impact in mental health for children. In Lancet, which is obviously a very recognized journal, what they've recognized is that they've seen children complaining of disrupted sleep. So they're not able to, nindra ma disruption. And also fear of getting infected. So some children, they don't want to get out of the house. And loneliness. These three were very high rated in different surveys. And what were the other risks? The context. बच्चाहरुको upbringing को context को कुरा गर्दाखेरि घरको family को situation एकदम important छ भन्ने कुरा पनि देखियो. त्यसमा if parents are experiencing psychological distress themselves, if there is a risk of domestic violence within family household, if parents are using substances, which meaning drugs and alcohol, if there is issues with parental separation and socioeconomic status of the parents, so if they're falling behind bills. And another thing obviously relevant, even for, sort of a lot of our audience here today is children of key workers. So these were very important aspects that escalated the risks of psychological impact in children. And what really stood out for me was also this category within 11 to 16 years old. यसमा के भनेको छ भन्दाखेरि यो एज ग्रुपको बच्चाहरु they're less likely to share their problems, and they try to cope with their problems themselves, and they're less open to change as well. So very important for us to remember this. One positive thing I found out from my own research was that 25% of household actually reported that their relationship with their parents improved. So that was quite nice to see. Moving on to young adults, 18 to 24 years old. Now, I must emphasize on this age group because a lot of research is going into this age group in particular. It is because 3/4 of mental health problems starts before mid-20s. So this was even before the pandemic. So with the pandemic, the risk has escalated, very understandably so. And if you look at the symptom profile, again, boredom, disrupted sleep, poor concentration are the main ones. But suicidal feeling and thoughts have definitely escalated within this age group. And I could look at the stats. It was about 22% in comparison to 10% in general population. And looking at, again, Mental Health Foundation research, they looked at different indicators of what were the areas that were being affected. हामीलाई अलिकति सरप्राइजिङ पनि होला. हामीले सोचौँला कि बुढाबुढीहरू हुनुहुन्छ, हाम्रो बुजुर्गहरू हुनुहुन्छ, उहाँहरू बढी लोनली फिल गर्नु भइरहेको होला अहिले पेन्डेमिकमा जस्तो लाग्छ हामीलाई. तर स्ट्याट्स सेज समथिङ डिफरेन्ट. सो स्ट्याटिस्टिक्स हेर्ने हो भने यो एज ग्रुप अफ पपुलेसन दे आर कम्प्लेनिङ अफ लोनलीनेस इन द मेजोरिटी अफ केस. सो हाइएस्ट नम्बर्स छ यो एज ग्रुपमा. अब त्यसमध्येमा पनि द रिस्क अफ बिङ फलोड, द इम्प्लोइमेन्टको हिसाबले हेर्ने हो भने 1/3 of young people are have lost their jobs or being furloughed in comparison to 1/6 of older adults. And also अर्को कुरा गर्ने हो भने we know young people they spend a lot of time in social media हैन we think obviously they're talking to their friends and connect गरिरहेको भन्ने हामी विचार गर्छौं अब त्यसमा दुईटा कुरा छ एउटा हामीले उनीहरु young people हरुले के सर्वेमा के देखाएको छ भन्दाखेरि टेक्नोलोजी cannot replace face to face त्यही भएर इम्प्याक्ट खास त्यति नै छ यो एज ग्रुपको मान्छेहरुलाई अनि सेकेन्डली चाहिँ के भन्दाखेरि it is also an area where they can be subject to cyberbullying or so there is this pressure of being perfect all the time to body image ko barema यस्तो कुराको धेरै pressure हुन्छ यो age group individuals हरुलाई and clearly they're quite worried about their future prospects and academic prospects. Another category within this is young carers. So a lot of us, we may or may not be aware, there are a lot of young carers who are looking after their parents, who are looking after vulnerable people within their family. And these people are also quite heavily affected by this. So moving on to older people, most of the factors are similar to what we've already discussed. The main kura isma ma ke highlight गर्न चाहन्छु भन्दाखेरि older people see their peers आफ्नै उमेरको जुन साथीहरु अनि फ्यामिलीहरुको death because of COVID अनि not being obviously worrying about their own physical health, mental health, and missing their milestones आफ्नो birthdays, anniversaries or आफ्नो loved ones हरुसँग family सँग बिताउन नपाउने त्यो कारणले पनि धेरै impact भएको छ यो generation of people लाई. But it was quite interesting to see that only 6% of over 70 people were complaining that they were not able to cope. So there was some positive slant to the impact of COVID on this group of people. But we have to remember this is in relation to other age group as well. Now coming on to Black, Asian and minority ethnics, this is a very interesting category. हामी सबै यही यसैमा fall गर्छौं. हामी as an audience, most of us fall into this category. यसमा के देखाएको छ भन्दाखेरि जुन key worker occupation हरु छ नि यसमा over representation of BAME people within that capacity. अनि त्यसले गर्दाखेरि obviously the risk of exposure to COVID is much higher. And on top of that, the cultural competency. So यसमा जुन किसिमको information cascade भइरहेछ. So government ले news हरुमा यस्तो छ भनेर every day हामीलाई information दिइरहेको छ. तर there is minimal reliable technical information for people who have language barrier, who are not able to understand the information. And त्यसले गर्दाखेरि they don't have the correct information in hand, which again increases the risks of getting infected. अनि अर्को चाहिँ digital exclusion पनि हो. धेरै जना household मा हाम्रो access to internet or access to digital platforms हरु छैन. And another factor is also self-employment, a 0-hour contract. A lot of BAME cohort of people are within that employment category. यसले गर्दाखेरि job stability को पनि problem छ. And we all know हाम्रो if we look into our own sort of living environment, we do have families where we live, multiple generations live in the same household. Again, this is another factor that was seen that obviously increases the exposure, increases transmission, but also the psychological impact of this and the mental health impact of this. So the last one is women. अब gender को हिसाबले कुरा गर्नु पर्दाखेरि के देखेको छ भन्दाखेरि women are in a position to make larger adjustments to manage household and childcare responsibilities. अनि अर्को interesting कुरा के देखे भन्दाखेरि women, they have more close friends. So therefore not having contact with friends affected their mental health. So these are the main categories, but there are other high-risk population as well, which I've put it on this slide. A lot of that I've already mentioned in my earlier slide, but just wanted to mention a few things, like people in abusive relationship, for example, domestic. मेरो questions पनि एक दुईवटा आएको छ as email through जुनमा domestic violence को कुराहरु भइरहेको थियो. यसमा पनि high risk मा पर्ने देखिएको छ. अब healthcare workers हरु धेरै aspects हरु छ. Firstly, that they are under a lot of stress at the moment working, जसले गर्दाखेरि mental health impact already नै थियो pre-pandemic level मा पनि, तर अहिले more because they see the real emotion, raw emotion right in front of them when they're dealing with people who are suffering. त्यसले गर्दाखेरि इम्प्याक्ट धेरै नै देखिएको छ अनि त्यसमा मात्रै नभइकन when they go home the impact of their own psychological well-being affects family and children at home अनि single parents मा especially lone mothers हरूमा बढी यो psychological impact देखिएको छ भने अरु categories like LGBTQI immigrants non-natives and people in manual jobs and even people working in arts sector ma pani yo impact body dekhiएको छ so overall भन्नु पर्दाखेरि women mainly यो low socio-economic status अनि त्यसमा पनि विभिन्न अरु physical health conditions सँगै these can add up to the challenge of the impact of mental health अनि children under 5 obviously we've talked about it as well earlier so हामीले कसरी चिन्ने त mental health symptoms हरुको बारेमा लक्षणहरुको बारेमा यहाँ म तपाईहरुले स्लाइडमा देख्नुहुनेछ I have categorized into 4 signs or 4 categories of mental ill health भनौं है अब म सबै एउटा गरेर त भन्दिन हैन तर behavioral signs physical signs emotional or cognitive signs हरु हुन्छ this is how mental ill health can manifest तपाईहरुले यसो हेर्नु भयो भने यस मध्येमा कतिवटा सिम्पटम्सहरु आफैले पनि एक्सपीरियन्स गर्नु भएको छ in fact no one is immune to this म आफैले पनि यसमा हेरे भने मलाई पनि यस्तो प्रब्लम्सहरु भएको थियो at some point हुन्छ नि especially in this pandemic period more so तर does that mean we have a mental health disorder this is where the question lies so हामीसँग यो सिम्पटम्सहरु भए पनि एक दुईवटा यहाँबाट भए पनि it doesn't suffice for us to have mental disorder until and unless they satisfy certain criteria so हाम्रो एउटा diagnosis गर्ने criteria हुन्छ अनि अर्को that these symptoms do not that there has to be some sort of uncharacteristic presentation भन्नुको अर्थ normal time मा भन्दा different हुनु पर्यो यो सिम्पटम्सहरु अलग हुनु पर्यो कहिलेकाहीँ आफूले रेकग्नाइज गर्न सकिरा हुँदैन कहिलेकाहीँ आफ्नो फ्यामिली मेम्बर्सहरु जसले हामीलाई धेरै राम्ररी चिन्नुहुन्छ उहाँहरुले कहिलेकाहीँ यो सिम्पटम्सहरु देखिराख्नुहुन्छ र साइन्सहरु देख्नुहुन्छ so that is crucial in in actually thinking about whether there is actually a problem with mental health तर childrenहरुमा कस्तो देखिन्छ भन्दाखेरि childrenहरुमा they're not able to vocalize or articulate their problems as we do adults do so there are certain signs that we can look out for mainly चाहिँ बच्चाहरुमा देखिने भनेको behavioral symptoms हैन धेरै mainly देखिने भनेको social interactionsहरुमा withdraw हुने अब सँगै एउटा कोठामा नबस्ने or धेरै नेगेटिभ कुराहरु गर्ने यो death को बारेमा कुरा गर्ने हुन्छ सुसाइड यस्तोहरु एकदम नेगेटिभ कुराहरु गर्ने and there is some drastic change in their behavior हैन कोही चाहिँ एकदमै outburst धेरै angry हुने या हुन्छ नि lash out गर्ने देखि लिएर खाँदै नखाने या सुत्नमा disruption हुने or certain weight changes हरु पनि देखिने अनि अरु धेरै चाहिँ physical symptoms हरु पनि देखिन्छ like headaches and stomach aches हरु complain गर्ने बच्चाहरुले अनि यो स्कुलहरु जान नमान्ने देखेर academic performance मा पनि धेरै फरक पर्न जाने यस्तो चीजहरु देखिन्छ so but we have to be mindful that when we are saying there is a mental disorder it has to be there has to be cluster of symptoms that satisfy certain diagnostic criteria so त्यही भएर आत्ति हाल्नु पर्ने जरुरी चाहिँ छैन तर it's very important for us to be aware अनि अर्को चाहिँ हाम्रो यो इम्प्याक्ट को बारेमा सो यो पेन्डेमिकले गर्दाखेरि short term medium term र long term impact कस्तो भइरहेको छ त मेन्टल हेल्थमा अब मेन्टल हेल्थमा पनि यहाँ मैले देखाउन खोजेको चाहिँ the most common disorders that we are seeing as professionals at work and also सबभन्दा बढी देखिने डिसअर्डर्सहरु छ यहाँ जुन चाहिँ एंजाइटी डिप्रेसन obsessive compulsive disorder र post traumatic stress disorder हो यो चारवटा चाहिँ एकदमै कमन देखिरहेछ अहिले प्र्याक्टिसमा अब यसमा मैले यो स्लाइडमा देखाउन खोजेको चाहिँ कज एन्ड इफेक्ट सो कजहरु हेर्नु भयो भने तपाईको जुन यो थ्रेट अफ कोभिड जुन छ हैन यो त पर्सिभ देखि लिएर एक्चुअल थ्रेट छ अर्को चाहिँ लुजिङ योर लभड वान्स हैन धेरै जनाले अनफर्चुनेटली दे हैव लस्ट देयर लभड वान्स टु कोभिड अर्को सोशल आइसोलेसन and not knowing when this is going to end ani the financial and economic impact of COVID, and also the relationship aspect of it. These are the main events that is happening at the moment. And in short term, there are two things that's happening. Either there is development of new symptoms, or mental health problems are emerging, or secondly, there is exacerbation of symptoms. So already mental health disorder bhayeko मान्छेहरुको चाहिँ symptoms body severe भएको देखिन्छ. अनि medium term र long term मा त्यही चीजहरु चाहिँ केही गरी अब त्यही भएर अहिले पेपर्सहरुमा पनि के देखेको छ भन्दाखेरि pandemicहरुको सिचुएसनमा it's about also the length of the pandemic. So कति समयसम्म चाहिँ यो pandemic रहिरहेको छ भन्नेले पनि धेरै it's directly also impacting on the mental health भन्ने पनि देखिएको छ. त्यही हिसाबले longer term effect मा हेर्ने हो भने if these stresses are maintained for longer period, it's likely that the symptoms or the disorder become more chronic भन्नाले they are there for longer period of time and much severe in symptoms. And another aspect to remember is that when symptoms become severe, especially in depression, it's likely for people to become suicidal. They don't want to live. Thoughts around सक्छ. अनि अर्को चाहिँ हाम्रो यो addiction, हैन? यो अहिले डेटा अनुसार चाहिँ 25% increase भएको देखिन्छ alcohol use मा. त्यसमा पनि हाम्रो younger adults हरुले बढी use गरिरहेको भन्ने चाहिँ डेटा छ. So how do we overcome this? अब मैले यहाँ यो तीनटा pillars of resilience भनेर राखेको छु. अनि again म यो questions-हरु email through आएको छ. कसरी हामी यो overcome गर्ने त mental health को बारेमा भन्दाखेरि first thing to really remember is being aware कि this doesn't feel right भन्ने कुरा चाहिँ हामी आफैलाई पनि थाहा भएर हुन्छ or हामीले आफ्नो loved ones हरुमा त्यस्तो के देखेको छ भने it's very important to be aware. एउटा त्यो भयो. अब मेन्टल हेल्थको ट्रिटमेन्टको हिसाबले गर्दाखेरि जहिले पनि हामीले सोच्ने हो भने तीनटा एस्पेक्टमा हेर्ने हो. जहिले पनि तीनटा भन्नाले पनि इट्स नेभर एउटा मात्रै ट्रिटमेन्ट भन्ने हुँदैन. फिजिकल हेल्थ, साइकोलोजिकल हेल्थ, रिलेसन सपोर्ट. मैले रिलेसन सपोर्ट लास्टमा राख्नुको पनि रिजन छ. इट्स लास्ट बट नट द लिस्ट भन्ने छ. त्यसको बारेमा अहिले चाहिँ म भन्छु. जुन हामीले सानो सानो कुराहरू भन्छौँ नि अब यो टाइममा खाने या एक्सरसाइज गर्ने, we have to be hydrated or sleep well भन्ने कुराहरू हुन्छ. These are very important aspects. Our physical health is very, very linked with mental health. त्यही भएर we need to really have consistency. So as I exercise गरे भोलि नगर्ने यस्तो हैन. We need to have consistent routine in our life. And same goes for sleep routine. मैले यहाँ अलिअलि वेबसाइट्सहरु त्यहाँ तपाईले देख्नुभयो भने राखेको छु. त्यसमा we can personalize our routine so that it's much close to and it is something that is realistically achievable. अनि अर्को psychological health. I think it's very important to remember that we're not using social media to such an extent that we're reading different things and negative things that's floating about, especially rumors. I would say focus on look at the very sort of recognizable websites like Gov UK and NHS websites and WHO websites to look for facts and limit the amount of information you get on every day. So once or twice check गर्ने दिनमा हैन त्यो भन्दा बढी नगर्ने. अनि अर्को चाहिँ हामी आफैमा पनि धेरै रेजिलियन्स हुन्छ जुन हामी आफैले ट्याप गर्न सकिरहेको हुँदैन. So being able to recognize that अनि हाम्रो past experienceबाट पनि हामीले थाहा भइरहेको हुन्छ how do we overcome certain difficulties भन्ने कुराहरू. Being able to do that and also focusing on solutions rather than problems, हैन, to be more realistic पनि. अब as म यति मतलब एक्सरसाइजमा पनि म आज 20k दौडिन्छु या हुन्छ नि अलिकति अनरियलिस्टिक गोल्स राख्नु भन्दा एउटा चाहिँ सेटिङ गोल्स दैट इज रियलिस्टिक त्यसले पनि धेरै हेल्प हुन्छ साइकोलोजिकल हेल्थको लागि. अब यो रिलेशनशिप र सपोर्ट इज एक्सट्रिमली क्रुशियल. इनफ्याक्ट हामी सबैजनाले कति कुराहरू थाहा नपाउने गरी कहिलेकाहीँ ग्रान्टेडलाई पनि लिइरहेको हुन्छ जस्तो लाग्छ मलाई. हाम्रो हुन्छ नि फ्यामिली अनि फ्रेन्ड्सहरू दे आर एक्सट्रिमली क्रुशियल टु मेन्टेन आवर साइकोलोजिकल वेलबिङ. अब यसमा पनि आफूले सपोर्ट लिने मात्र हैन अरूलाई सपोर्ट दिने अनि यो कहिलेकाहीँ आफूले ट्राई नगरेसम्म थाहा पनि हुँदैन. त्यही भएर कहिलेकाहीँ यो हाम्रो यो NHS भोलिन्टियर रेस्पोन्डर्स भन्ने पनि अहिले सुरु भएको छ जहाँ वी क्यान अल भोलिन्टियर टु हेल्प अदर्स हैन. एउटा स्मल हेल्प अरूलाई गर्दाखेरि पनि त्यसले जुन लेभलको स्याटिस्फ्याक्सन जुन लेभलको अचिभमेन्टको सेन्स दिन्छ नि that is also a source of maintaining a good psychological good health, mental well health. It's very important to recognize that. अब यहाँ different मैले यो recommended helplines हरु राखेको छु जुनमा specific problems को लागि different third sector charities हरु छ which we are not aware of. तर I have information on that. I'm more than happy to circulate that after our talk later. अनि यति भन्दै म आजको presentation चाहिँ यही end गर्छु. अनि एउटा मात्रै मैले यो क्वेशन्सहरुको कुरा गर्दाखेरि एक दुईवटा कुराहरु जुन मैले आज मेरो प्रेजेन्टेसनबाट कभर गरेको छैन त्यो चाहिँ एउटा क्वेशन के छ भन्दाखेरि यो what is the technical difference between depression, anxiety and stress? Is it useful for us to understand their nature and cause in order to avoid being a victim भन्ने एउटा क्वेशन आएको थियो. यो चाहिँ टेक्निकल डिफरेन्स भनेर सोध्नु भएको छ. मेन यसमा टेक्निकल डिफरेन्स भन्दाखेरि डिप्रेसन र एंजाइटी these are different these are names for different mental health disorder, and the way we differentiate mental health disorder is by their signs and symptoms, and they have very specific set of symptoms. Not just symptoms, but it's also about the duration and the impact of the mental impact of these symptoms on the function, so ability to function, be it in relationship, occupation. Yes, the sub factors are important. So when we go and diagnose somebody to either be depressed or be anxious, so they are very unique disorders. So technical difference is that stress itself stress le garदाखेरि चाहिँ mental disorder हुने हो. So it's almost like a cause to mental disorders. And it's very important to recognize, of course, and understand. It's very important to be aware of something that sounds and feels different than your usual self. So yeah, I think other questions are मैले answer गरेको जस्तो लाग्छ. तर if I have not answered your questions, please feel free to get back to me via email. So yeah, I'm over to you, Pranisha. Thank you very much for listening.
Pranisha ji, please take over and
sorry.
Questions. It's okay.
Sorry. Thank you, Dr. Nikki ji. तपाईको प्रेजेन्टेसनको लागि अब चाहिँ हाम्रो क्वेशन एन्ड आन्सर सेसन चाहिँ सुरु हुँदैछ. त्यसको लागि चाहिँ तपाईले अब उहाँले दिनुभएको यो प्रेजेन्टेसनमा तपाईहरुको यो क्वेशनको आन्सर भएको छैन आएको छैन भने चाहिँ प्लिज क्वेशन सोधिदिनु होला. तर एकजनाले एउटा मात्र क्वेशन सोधिनु होला है. Unmute yourself or you can raise a hand and then we can unmute. Anyone? Okay.
Can I ask one question, please?
Yeah, of course.
Yeah. Okay, so it's just a great talk. Yeah, thanks. And so what is the definition of happiness? And say, for example, if you want to tweak small things in your life, so what would that be, in your view?
Happiness it can be very subjective. I think किन भन्दाखेरि एउटा कुनै कारणले एकजना इन्डिभिजुअल ह्याप्पीनेस त्यही कारणले दिन्छ भने अर्को मान्छेलाई त्यही चीज ह्याप्पीनेसको सोर्स नहुन सक्छ. So it's very subjective. So that is why it's very important to recognize what is important to you. मेरो विचारमा चाहिँ. So to be happy, you really need to recognize what you value. अनि त्यहीबाट I think mental health को हिसाबले कुरा गर्दाखेरि चाहिँ यो aspect, I think that's a very pertinent question actually. किन भन्दाखेरि कहिलेकाहीँ हामी आफैलाई चाहिँ थाहा भएर हुँदैन, हाम्रो प्रायोरिटिज, हाम्रो भ्याल्युजहरुको बारेमा हामीलाई त्यति अवेयरनेस भएको हुँदैन. And I think it starts from there really, and being aware of things that is important to you, and I think that and being able to achieve that will make sure that you are happy. I don't know if I've answered your question, Sachitan.
And like I say, if anybody wants to have a small change or tick in their life, what would that be? In order to achieve kind of happiness.
So small change.
Yeah, small changes. What we can do.
Okay, for example, अघि मैले भनेको थिएँ नि, like sometimes we don't realize that as human beings हामी sometimes we are quite self-centered. मलाई यस्तो लाग्छ किन that's human nature हैन. अनि मलाई यस्तो भयो भने म खुसी हुन्छु, मलाई यो पाएँ भने म खुसी हुन्छु, यस्तो भयो भने तर sometimes we don't realize that actually giving can make you happy हुन्छ नि. अरूलाई केही राम्रो गर्यो भने चाहिँ and let's just take this as an example. आजकै यो फोरमकै कुरा गरौँ न हैन. हामीले यो मेन्टल हेल्थको बारेमा यसरी ओपनली कुरा पनि गरिरहेका छौँ र यो कति मान्छेहरू जुन अडियन्समा हुनुहुन्छ उहाँले सोची पनि राख्नु भएको छ होला, कति कुराहरू आज रेजोनेट पनि भएको होला. So being able to give and support others can also be a source of happiness. So that is in some ways small thing, अलिकति different पनि हो र अलिकति small, but it can be very subjective. So त्यही कुराले अरू कसैलाई happiness नहुन सक्छ.
Thank you.
Can I?
Hello. Sorry, mute my sorry. Sasi Manan. Hello. Please, I have no question.
Hello, Nikki.
Hello. Namaste.
Namaste. To talk and your presentation was very good. I really got to the nitty-gritty of the problems associated with COVID-19. What I wanted to ask is in relation to one of the issues that I think has been discussed, agoraphobia. How has agoraphobia increased in the current times, and how do you suggest people deal with agoraphobia? How do you approach the person with agoraphobia, and how do you help them deal with it?
So, ekdamai pertinent question, and in fact, just for the sake of our audience today, to explain what agoraphobia is. So agoraphobia is नेपालीमै भन्नु पर्दाखेरि चाहिँ extreme fear of leaving an enclosed space, and especially a house भनौँ न, घरबाट निस्किने extreme fear. त्यो fear mainly if you don't know where the exit is. And agoraphobia can be extreme in situations where there's no exit. For example, if you're in a bus, you're in a plane, or somewhere you can't escape. So agoraphobia भनेको चाहिँ त्यही हो. And a very pertinent question, Sasi uncle. I think a lot of, in fact, patients that I care for have agoraphobia as their main problem, and it's intensified so much in the pandemic. And it is one of the most trickiest mental disorder, I must say, in this current climate. How do we address that? Now, one of the things that we have been doing at the moment is that using our sort of other ways, because we can't go and see them, or we can't ask them to leave the house, or because they can't leave the house. It's really starting the conversation with them on the phone and using their people who are quite close to them. So for example, if they have family members who are looking after, who know them very well, to start the conversation in regards to how they are really. कस्तो भइरहेको छ, कसरी इम्प्याक्ट भइरहेको छ, फर्स्टमा चाहिँ त्यसरी कुरा गर्नेबाट सुरु हुन्छ. अनि त्यहाँबाट हेल्प गर्ने भनेकै चाहिँ होप देखाउने पनि very important. Like हुन्छ नि, अब अहिले यस्तो छ सिचुएसन, यस्तो हिसाबले they can't go out, they can't do the things they enjoy, and they've never been out in fact. तर इन्ट्रेस्टिङली तपाईले यस्तो पनि देखिएको छ कि कतिजना सिम्पटम्सहरू इम्प्रुभ पनि भएको देखिन्छ. किन भन्दाखेरि they know that the whole world is with them at the moment. कति मान्छेहरू they can't go even if they don't have it. So in that sense, and कतिलाई फेरि they feel like there are other people who are there with them. अनि अहिले हामीले गर्ने सक्ने भनेकै कस्तो छ भन्दाखेरि फोनबाट नै सपोर्टहरू दिने. अहिले within mental health services there is something called well-being network. तपाईहरुले सुन्नु भएको छैन होला, तर उनीहरुले चाहिँ के गरिरहेको छ भन्दाखेरि when full PPE लाएरै पनि उहाँहरु चाहिँ घरमा गएर घरबाट गार्डन सम्म जाने, अनि हुन्छ नि फेज्ड वेबाट के घरबाट गार्डन, अनि गार्डनबाट त्यो अगाडिको फ्रन्ट डोर, यसरी पनि हेल्प गर्ने सपोर्ट हामीले दिइरहेको छौं 31 जना हाम्रो क्लाइन्टहरुलाई. It's really about phased, gradual, progressive support in coming out of the house. अहिलेलाई चाहिँ त्यो प्र्याक्टिस हामीले गरिरहेछौँ.
Thank you, Nikki ji, for your answer. Next one, I think Lojan Manandar ji le चाहिँ आफ्नो question राख्दिनु होला. Yes.
Namaste, Nikki Shakya, wow, I think you really took me back to my medical days.
Okay.
And it was so informative that I'm becoming a student now. Anyway, it was very informative, very nice. Thank you.
Thank you.
The question is that you may say that it's going to be a little bit vague. What my question is that you talk about the cause and effect. Now the cause, and now in UK, how this, who is going to find out that somebody has got a depression? Now, you know, the chain of reaction over here is that you, family member, or even if I have got something, that I have to go through the GP. Yeah? And like you say that, I'm sure you're aware of that, with the, supposing if I have got depression, so the family member or the relatives say that I have got depression, you are depressed, you go and see the doctor, and you go to the GP, and then is the GP is going to find the cause? The reason that I'm saying is that even I was one time, I went to see the GP just for the sake of, you know, going to see the, I mean, for the reason, obviously. And what the GP does, they send you to the counselor. And obviously counselor is not going to sort of diagnose that. And at that time, I found out that this is not it. They're not trying to find out the cause. They're trying to evade. They're trying to find out, oh, you are depressed, so you go and see the counselor, talk. And as you are a hospital doctor, my question is that at what stage you see the depressive people, and what is your treatment for them? Because according to me, as far as I know a little about it, I know nothing about the psychiatry, but to find out the cause, when somebody comes, somebody said that the GP, either the GP has to be trained psychiatrically, you have to do all the various treatment, I mean, not treatment, all the various investigation, you know, before you label the person is depressed. But I find it, this is not happening in UK.
Okay.
And people talk about that, you know, mental illness, or yeah, they're not looking after by the government and all this thing. Maybe there is something, the lack, you know, the cause and the diagnosing.
Thank you for the question, really. I do understand your dilemma as to what's going on within the services, and this is something I've heard from different sources as well. So when we talk about depression or any mental illness, it's really about, when we meet somebody, it's first time, so for example, somebody goes see their GP and they say, I've got these symptoms. So to point, sometimes it's not always easy to say, yes, you are depressed, or no, you're not. And mental illness, especially you don't always have set numbers of things to say or suffice to certain disorder. Ekdam gray area hunsa. You have some symptoms, you don't have other symptoms. So it's about the impact of those symptoms that has in you. So kati impact who is suffering. That's very important. So when you go to GP, usually GPs are quite good in diagnosing depression, because depression is so common at the moment. 1 in 4 of us, we suffer from depression. GPs, I work very closely with GPs, and they are quite good at diagnosing mild and even to severe depression, and then escalating if they're not able to manage by after, you know, starting the antidepressant and having psychological treatment. If they're not able to manage, then they ask for referral to specialist services. तर तपाईले अगाडि भन्नुभएको जुन काउन्सिलिङको कुरा गर्नुभयो नि हैन, यो treatment mental illness को कुरा गर्दाखेरि it's a journey. It's a journey. So you come with certain symptoms, you go to GP, and GP makes some recommendations. first starting point ma धेरै जसो चाहिँ what they really want to do and what they're trying to do is for this person to feel comfortable talking about their problems. And the first stage is really about having that भनौं न एउटा platform where they can talk about it. And counselors, again, if you go into the territory of counselors and psychologists, they become totally different topic of discussion hunecha. Tara they refer to counselors because they want people to talk about their problems to start off with at that stage. कतिलाई awareness भइरहेको हुँदैन नि त आफ्नो problemsहरुको बारेमा. So when you start talking about it, they're more aware of it, and counselor help them make sense of what is going on. अनि GPsहरुले गर्न खोजेको चाहिँ त्यो हो मेरो perspective.
You're trying to find out the cause, though, is it?
So cause for depression or any kind of mental illness, it's multifactorial. So it's not always very clear cut to say यो कारणले चाहिँ मलाई depression भइरहेछ या यो किनभने multifactorial किन भनेको भन्दाखेरि कोही मान्छेहरु they are genetically vulnerable to become depressed, and there are other factors like social and psychological aspects that make people more prone to depression. हैन अहिलेको अघि मैले प्रेजेन्ट गरे जस्तै different the three aspects को कुरा गरे नि त्यही हिसाबले चाहिँ कहिलेकाहीँ it's very difficult to say exactly what is causing depression at one given time.
I think a GP is pretty good in prescribing the antidepressants. I mean, that is one of the things that I think we should, well, I think from my point of view, or from the different people that I heard, that to prescribe antidepressant without knowing the actual cause is itself very harming. So to me, that like you say, it's a multifactorial. So you have to eliminate the basic cause. Yes. There are so many clinically there are so many things you can eliminate by investigating, right?
Of course,
with a blood test and all that. That never has been done by the GP. I mean, I am a little bit, although not knowing too much about the psychiatry, I think here, like you said, GP, I don't think they are really well trained. And I also feel that not only me, or for everybody, there are so many people that I knew, because, being a doctor, I also meet so many people, and it is just not right to me.
Sorry to hear about that. Reality मा चाहिँ मैले देखेको चाहिँ कस्तो छ भन्दाखेरि GPs हरुले इनिशियल स्टेजमा चाहिँ सपोर्ट दिन खोज्छ हैन, like they do investigate at not all the time, but usually if there is a very clear cut, for example thyroid issues ले पनि depression हुन सक्छ नि त हैन, thyroid को level ले पनि depression is very common. कहिलेकाहीँ they forget about it and they referrals come to us and like, have you checked their thyroid? भन्छ thyroid level हेरेछ कि छैन.
I have to tell them, have you done this, have you done that? I mean, sometimes it is very hard for the people to do it. They're not trained. I'm sure.
But what I wanted to reassure you to say that we don't always have to go through GPs to seek support. In fact, as we speak right now, mental health services are going through a very big reconfiguration. NHS त जहिले पनि evolve भइ नै रहेको हुन्छ, तर अहिले चाहिँ at this point mental health services there are completely changing, especially looking at the social determinants of mental health. के अघि तपाईले भन्नुभएको छ त्यो social कुराहरुलाई चाहिँ incorporate कसरी गर्ने, त्यही भएर यो third sector organizations हरु जुन voluntary charity organizations हरु छ नि, they're all coming to the fore to support the person. Even GP कै जानु पर्छ भन्ने पनि छैन, they can access these charities and actually get the help they need.
That probably is better, actually, not through the GP and not going through just a waste of time. The more you delay, the worse it is.
It is a challenge right now, even for us professionals. Sometimes it's sort of hard to sometimes educate certain GPs. That's true, but there is a national sort of move towards improving mental health services.
Can I make one suggestion?
Sorry, Lochanji.
Yes, let's move on to the next question. Yes.
Yeah, so time there is so Krishna ji हुनुहुन्छ, उहाँले चाहिँ आफ्नो क्वेशन राख्दिनु होला, please.
Hello, Jazalapa, Sakista, and Nikki. Very, very nice presentation. I'm proud of you, really proud of you, and it's very useful. It might be it sound be a little bit, other part of the pandemic. I'm just talking completely other part of it, despite of so many negative impacts of pandemic, so many depressions or whatever you've been talking, so many good things. I mean, good things to know, good to know those things. Just as I always see that there are always two sides of coin, yes? So that is now from the positive part of the pandemic, from the positive side, it's also important. I think perhaps when you can spread out the positive part of it, perhaps that may also encourage some people to get for their betterment, I would say. Just merely for instance, I have been working all the time away and away and away from home. Now I'm getting an opportunity to stay home and home and home while working from home. So this is a positive part for me. I'm really enjoying. I never stayed this long, almost one whole year at home. I never stayed in my life, but this is something, for me, good part. And another next good part thing is now because of this, we are learning way of working, new normal, we call it, new normal. And so it looks like now many working styles and living styles will change because of that. And those will be more economical. Those will be more beneficial in many ways. So I take this as a positive part of it. And at the same time, having this kind of pandemic, you never know what will be next pandemic or how long this will continue. So we will be learning a lot of lessons out of that, getting prepared for all this. So these are the lessons to be learned. So I believe if we can spread out a little bit positive part of it, I think that will help. What do you say?
Absolutely, absolutely. I can't agree more to that, Uncle. I think one of the things that I also said in my presentation was that 25% of people have actually reported that their relationship with their family, parents, children have actually reported that their relationship with family have improved. Because they've had that opportunity to actually get to know properly, That is one thing. And another thing I've actually also noticed in workplace is that you're actually asking how you are. How are you? Questions. And we're asking that more often. We're making sure that we're looking after each other more than usual.
Correct.
I think we're making more contacts with our parents, even speaking of myself, I'm checking on my parents much more than usual. So it's definitely, those things have definitely improved, I would say, yes.
Yeah, thank you. Thank you. Very well done.
Thank you, Nikki ji. कृष्ण चकुन्जीलाई पनि धेरै धन्यवाद। अरु यहाँ उपस्थित हुनुभएको अरु कोही पार्टिसिपेन्टहरुको क्वेशन छ भने चाहिँ प्लिज रेज योर ह्यान्ड, आफ्नो भिडियो अन गर्नु होला अनि सोध्नु होला है। ओके, न्युमिला जीले आफ्नो हात उठाउनु भएको छ, म उहाँलाई अनम्युट गर्दैछु। प्लिज आफ्नो भिडियो चाहिँ अन गरिदिनु होला है।
So I just had a question regarding one of your slides. So it was about the main high-risk population group. So in that, I've read somewhere, men under 45, the highest killer is suicide. So I was just wondering how it's impacted men.
Yeah, that's absolutely true. So this is true even before pre-pandemic. So pre-pandemic, even before pandemic, male middle-aged men, in fact, this is a statistics that is actually changing over the course of time. Tara, especially even if we think about risks when we assess somebody, let's say in emergency department or in community setting, middle-aged men with different other risk factors, who are living alone, who are unemployed, who are using drugs and alcohol, who do not have the social support or network, all of that increases the risk, and age also being one of the prime reasons. But specifically in this pandemic, as I highlighted earlier, 18 to 24-year-old cohort population, there has been an increased rise in suicidal thoughts. So it's very important to remember that as well, thoughts and act. So suicide statistics itself is very unclear at the moment. Pandemic le garदाखेरि ko direct suicidal statistics researchers are not able to say for definite that it's having an impact, direct impact, but definitely for suicidal thoughts and feelings, it has definitely increased.
Okay, thank you, Nikki ji.
No problem.
Okay, so anyone else? Last one, कोही हुनुहुन्छ भने किनभने हामीसँग टाइम छैन, अब 1 मिनेट मात्र बाँकी छ, so last कोही हुनुहुन्छ भने please raise your hand. अनि आफ्नो चाहिँ क्वेशन राख्नु होला. शशीजीले अघि क्वेशन सोध्नु भइसक्यो, सरी म फेरि तपाईलाई चाहिँ चान्स दिन्न, सरी. अरु कोही हुनुहुन्छ?
एउटा क्वेशन मेरो तर्फबाट पनि छ. सायद अहिले यो पछि भ्यायो भने शशीबाट पनि क्वेशन लिउँला. मेरो तर्फबाट क्वेशन चाहिँ so mental health patientले without any medication आफूलाई क्योर गर्न सक्छ भने what can they do without taking pills and हुन्छ नि antidepressants? What are the 3 best things for a mental health patient to do is my question.
So I'm glad that you said 3 best things because I actually had 3 pillars of resilience in my presentation, if you noticed. So again, so mental health, it's about the degree of symptoms. Mild देखि त्यही भएर depression को specifically कुरा गर्दाखेरि mild देखि severe हुन्छ. त्यसमा mild किन भन्ने र severe किन भन्नेको specific reasons हरू छ, हैन? अनि अघि मैले सुरुमा भन्दाखेरि जस्तै सिम्पटम्सहरु क्लस्टरमा हुन्छ कि यो सिम्पटम्सहरु हुन्छ भने सिम्पटम काउन्ट पनि गर्छौं हामी, हैन? तर it's also about the impact of the symptoms on someone, हैन? त्यही भएर for example, if you only have mild symptoms, especially mild depression मात्रै हो भने हाम्रो जुन गाइडलाइन ले चाहिँ don't treat mild depression भनेको छ with antidepressant. You shouldn't be treating mild depression and antidepressant because केही गरी अघि लोचनजीले चाहिँ भन्नुभएको जस्तै if there are other factors that can be managed without medication, then it certainly can remedy a lot of the symptoms that are there, right? So one of the things, the 3 things भन्दाखेरि अघि मैले भने चाहिँ first thing is obviously looking after yourself physically and mentally. So again, it can be very specific for that person. So कसैलाई exercise गरेर they feel better, it may not be the same for other person. So finding your own ways of making you feel good, doing things that makes you happy. Happiness ko pani kura bhayo, so it's finding that in you. So that is one thing which may sound really cliche, but it's quite important to do that. And another thing is connecting with other people, so connecting with your friends, connecting with families, and making effort to do that as well, and making it meaningful rather than just talking superficially like kura garyo सक्यो भने जस्तो हैन कि अब आज के गर्ने त, like एउटा certain set goals राख्ने कि like certain एउटा काम गर्ने, अनि किनभने it's very important to have that sense of achievement by the end of doing something, so meaningful activity. अनि अर्को चाहिँ having some ability to look into yourself, भन्नुको मतलब are you able to reframe your negative thoughts? There's no point getting the same result by repeating the same thing, so you need to change your thinking or change certain aspects of your behavior to get different results, you know, and the result that perhaps, you know, might be more beneficial for you. So those would be the 3 things I would say.
Okay, so that was my personal thought for a question. So I would say, as being in the Pasa Pucha Guthi UK London community engagement ko tarfबाट हेर्दाखेरि चाहिँ if we were to do 2 events online, still I think we'll still be online, what would you recommend us to do to tackle mental health issues in our community? What sort of events would you think would be more beneficial?
So events को कुरा त गर्नु भयो हैन, मेरो विचारमा चाहिँ अहिले मैले आफैले काममा पनि देखेको चाहिँ what are the things that might be effective or realistically achievable भनौं न. how much ever we deny it, there is always some amount of stigma attached to mental health. So a lot of people may not find it comfortable talking in a sort of, group environment or in events like this. And it's very true. And especially for certain age group, it might be even more challenging, त्यही भएर चाहिँ मैले 2-3वटा कुरा चाहिँ के अहिले हामी काममा पनि हाम्रो आफ्नो वर्क प्लेसमा गर्छौँ भन्दाखेरि लिफलेटिङहरू गर्छौँ कि लाइक हुन्छ नि इन अ मोर सort of युजर फ्रेन्डली म्यानर लाइक फर इक्जाम्पल ल्याङ्ग्वेजकै हिसाबले भनौँ न ल नेपालीमै मेन्टल हेल्थको बारेमा केही हामीले लिफलेट बनाएर घर घरमा अब हामी टेकअवेजहरू पठाउँछ नि रेस्टुरेन्टहरूको त्यस्तै गरी कि घर घरमा चाहिँ लिफलेटिङ गर्यो भने हाम्रो बुढा बुजुर्गहरूले पनि हेर्न सक्ने गरी या बच्चाहरूले पनि पढ्न सक्ने गरी एकदम युजर फ्रेन्डली खाली लिफलेट्स भयो भने त्यो एउटा बेसिक इन्फर्मेसन अनि हु टु गो टु भन्ने हिसाबले कि लाइक वेयर इज सपोर्ट अभाइलेबल किनभने एक्सेसको धेरै च्यालेन्ज छ हाम्रो यो बेम कम्युनिटीमा कहाँ छ हेल्प भन्ने चिज चाहिँ वी आर नट भेरी अवेर अफ इट अघि नै कुरा गर्दाखेरि पनि अल वी थिङ्क इज ओके गो टु जिपी तर समटाइम्स वी डोन्ट फाइन्ड आवर सेल्फ बिङ हर्ड होइन त्यही भएर देयर आर lots and lots of charity organization and I'm happy to circulate the contact details and numbers of that after the talk today. So there are ways of self-referring to those charities. We just have to pick up the phone and talk to them. एउटा त्यो भयो अब तपाईको इभेन्टकै हिसाबले कुरा गर्दाखेरि चाहिँ I think it's first is about spreading awareness हैन र त्यो के गरी चाहिँ कुनै एज स्पेसिफिक हामीले गर्न सक्छ फर इक्जाम्पल इट कुड बी मैले अगाडि यो लकडाउन पेन्डेमिक भन्दा अगाडि मैले युनिभर्सिटी स्टुडेन्ट्सहरूलाई एउटा टक दिएको थिएँ यो मेन्टल हेल्थको बारेमा सो यु हेभ अ भेरी स्पेसिफिक अडियन्स द्याट यु क्यान रिलेट टु एन्ड टक टु इन अ भेरी स्पेसल अनि किनभने इट माइट नट अलवेज बी अ कम्फर्टेबल इन्भाइरोमेन्ट टु हेभ डिफ्रेन्ट एज ग्रुप आइम जस्ट सेयिङ बिकज इट इज द रियालिटी so events or pachi organize gardakheri that might be something we may consider to have certain age group catered for very specific targeted to very specific age group bhanau na euta tyo bhayo ani arko चाहिँ अब मैले चाहिँ अगाडि सोचेको चाहिँ हाम्रो काम अहिले यो वर्क प्लेसमा पनि हामीले ग्रुप के सपोर्ट ग्रुप्समा चाहिँ people who have similar problems they come together and they able to relate to each other के कतिले चाहिँ आफूले एक्सपिरियन्स नगरेको चिजहरू यु कान्ट imagine what other person is going through but if you are also suffering this like you can be in the shoes of other person you're able to support each other more so support groups चाहिँ अर्को एउटा गर्न सकिन्छ तर whether that can be done as an online I think it can be because that's what we're doing at work so
awesome no thank you very much thank you
no problem I would say हाम्रो कोही क्वेसन्स छैन जी शशिमानन्दजीले हात उठाउनु भएको थियो अघि प्लिज क्वेसन छ भने प्लिज सोधिनु होला
सुरेशजीले पनि हात उठाइरहेको देखिरहेको छु मैले सुरेश वैद्यजी
ओके सुरेशजीले शशिमानन्दजीले आई थिङ्क के गरौँ उहाँ अनम्युट गर्नु पहिला शशिजीलाई चाहिँ एकचोटि गरौँ न हुन्छ शशिजी प्लिज आफ्नो भिडियो अन गर्नु होला अनि आफ्नो क्वेसन राखिदिनु होला थ्याङ्क यू
Nikki, I just wanted to know if you have any statistics to do with the increase in depression or other issues that's increased through this COVID times. Medication, that increase in medication for depression, agoraphobia or whatever,
Increase in medication use,
Yeah.
Increase in medication use.
Yeah. In the NHS, have they been giving more medicines out for more people now?
So statistically, it's a exact number at this point, but certainly depression itself is being much more diagnosed in the scenario. मैले अगाडिको त्यो स्लाइडमा फर्स्टको स्लाइडमा मैले देखाउन खोज्दाखेरि त्यहाँ फर्स्ट ग्राफ if you I can show you if I show you this first graph. Is that okay? Just to quickly share.
Yeah. How it's multiplied, in terms of medication.
Okay, so so June you slides first you can see 31% rise like so 16 to 39. And so age group depression has definitely been diagnosed more and it's to say definitely. So in terms of medication, it's very likely that if you're diagnosing someone with depression, for them to go untreated is very unlikely. In fact, yeah, I think that I'm quite aware that this question is quite relevant in the sense that we do not want to be medicalizing depression, because a lot of us suffer from it. But if it's when I say mild but moderate moderate depression, because there is evidence that antidepressants do work. No, otherwise we wouldn't be using it. Stats now, I'm more than I think it's much more likely that definitely the number has increased for antidepressants for sure.
So like Lochan was saying earlier, the doctors, the GPs are willy-nilly supplying or prescribing those medications without actually understanding the severity of the depression. Is that more that's happening because of the COVID, you think, as well?
It is. I think it's also sometimes it's as I said earlier regarding the sort of being quite definite about which degree of depression it is. Yeah. We also have to be mindful that there are certain mental disorders whereby you have to treat with medication. There's no other option. That's hard, that it's always multifactorial and it's always going to be 3 pillars of resilience, as we talked about. But there's certain disorder you have to prescribe medication. For example, for let's say psychotic disorders, schizophrenic disorders, where you have to treat with medication. The depression is one of those illnesses whereby antidepressant has a role only after they have certain degree of symptoms. But yes, it is likely that it is increasing, but I do not have the evidence or statistics to support that at the moment.
Yeah, I think it's difficult all around because you can't get thyroid tests or blood tests to do with endocrine or whatever. So they're more likely to give the medication out, I suppose.
And this is where sometimes we do kind of say, oh, have you checked this? As I said earlier, sometimes it goes unnoticed. And there are a lot of cases whereby I've actually asked my clients to, you can stop your medication after a certain time, if your symptoms are cured, because after 6 to 9 months of trialing an antidepressant for your first episode depression, we can ask patients to come off their medication.
Okay. Thank you.
Thank you, Nikki ji.
Yes.
Sorry. Participant हुनुहुन्छ सुरेश वैद्यजी, उहाँले चाहिँ आफ्नो हात उठाउनु भएको छ. प्लिज आफ्नो क्वेशन राख्दिनु होला.
नमस्ते हजुर, म सबैलाई.
नमस्ते.
खास अहिले कस्तो भइरहेछ नि, अहिले संसारभरि नै अहिले डिप्रेसनमा गइरहेछ अलमोस्ट पिपलहरु. त्यसले गर्दाखेरि कस्तो भने अब यसलाई कसरी अब त्यसलाई उ गर्न सकिन्छ, सल्भ गर्न सकिन्छ डिप्रेसनलाई कसरी, र अब कुन अब औषधिहरु के निस्केको छ डिप्रेसनको लागि हैन, र कसरी मेनली गरेर डिप्रेसनलाई चाहिँ हामीले उ गर्न सकिन्छ.
हजुर, डेफिनेटली डिप्रेसनको प्रेभलेन्स एकदम बढेको छ. तर अब मेन हामीले हेर्नु पर्दाखेरि जहिले पनि हामीले मेन्टल डिसअर्डर भनेर सोच्दाखेरि डिप्रेसन मात्रै सम्झिन्छौँ नि, तर देयर आर सो मेनी अदर मेन्टल डिसअर्डर्स कि जुन बढेको छ कि डिप्रेसन मात्रै हैन. तर अहिले हामीले अघि मैले भने जस्तै डिप्रेसन भयो, एङ्जाइटी भयो, अनि यो ओसिडी के यो अब्सेसिभ कम्पल्सिभ डिसअर्डर, जहाँ चाहिँ धेरै सफा गर्नुपर्ने या हुन्छ नि हातहरू धोइराख्नुपर्ने रोग अर्को छ, जुन हामी अहिले गर्नु परिरहेछ तर एकदम धेरै गर्ने रोग अर्को त्यो पनि छ. अनि त्यहाँबाट गएर हाम्रो पिटिएसडी भन्ने पनि छ. धेरै रोगहरू छ जुन बढेको छ, तर डजन्ट नेसेसरली मिन कि यसको सल्युसन छैन. अघि भनेको जस्तै इट हेज टु स्टार्ट फ्रम स्मल थिङ्स कि सानो सानो कुराबाट चाहिँ हामीले आफैले गर्न सक्ने चिज जुन चाहिँ स्पेसली सपोर्टै नभइकन पनि हामी आफैले घरैबाट चाहिँ जुन गर्न सक्ने चिजहरू मैले अघि भने त्यो चिजहरूलाई हामीले ध्यान दिएर गर्न सक्यौँ भने धेरै कुराहरू हामीले घरैमा पनि निर्मूल गर्न सक्छौँ. अनि यो रोग मेन्टल हेल्थको रोग भनेको चिज कति मान्छेहरूलाई चाहिँ अलिकति यो हो मलाई चाहिँ यस्तो प्रब्लम भयो, अब यो मलाई सधैँ यस्तै नै हुन्छ भन्ने पनि हुन्छ. तर इट्स अ फेजिक प्रब्लम पनि कि कहिले आउँछ जान्छ, फेरि आउँछ जान्छ. इफ इट इज एड्रेस एट द राइट टाइम, अर्ली स्टेजमा गर्न सक्यो भने देयर इज अ वे आउट अफ दिस.
एकदमै डिप्रेसनमा गएको छ भने उसलाई चाहिँ कसरी हामीले चाहिँ गर्न सकिन्छ, उसलाई अब ठाउँमा ल्याउन सकिन्छ हामीले.
तर फर्स्टमा गर्ने भनेको डिग्री बढ्ने बित्तिकै एन्टिडिप्रेसेन्ट्सहरू हुन्छ. अब एन्टिडिप्रेसेन्ट्स धेरै थरीका छन् हैन, अनि त्यो धेरै थरीका हुनुको कारण चाहिँ किन भन्दाखेरि कसैलाई सरी त्यो अलिकति फिडब्याक आयो. कसैलाई कुनै एन्टिडिप्रेसेन्टले काम गर्छ भने त्यही एन्टिडिप्रेसेन्ट अर्को मान्छेलाई काम गर्दैन हैन त्यही भएर कहिलेकाहीँ टु फाइन्ड द राइट मेडिकेसन पनि एउटा जर्नी हुन्छ कति सिचुएसनमा त्यही भएर चाहिँ इट्स अबाउट देयर डिफ्रेन्ट काइन्ड्स अब त्यो आज हाम्रो यो टाइमको हिसाबले अलि लिमिटेड छ एक्ज्याक्टली नामहरू र के हो भनेर भन्नलाई तर देयर डिफ्रेन्ट टाइप्स अफ मेडिकेसन बिकज अल दिस मेडिकेसन कम विथ साइड इफेक्ट्स अनि कसैलाई टलरेबल हुँदैन अनि त्यही भएर हामी चप एन्ड चेन्ज गरेर चाहिँ डिफ्रेन्ट एन्टिडिप्रेसेन्टहरू ट्राई गर्छौँ अनि अन्तिममा आएर के गरे एकदमै सिभियर सिम्पटम्सहरू छ भने चाहिँ हामीले हस्पिटल पनि एडमिसन गर्ने अभियसली फेसिलिटी छ
तर म चाहिँ खास गर्छु नि म त स्पोर्ट्सहरु सिकाउँछु हैन स्पोर्ट्स गराउँछु
हजुर
स्पोर्ट्सले पनि धेरै हेल्पफुल त हुन्छ तर पनि अब अरू वेहरू पनि हुन्छ कस्तो खालको हो हैन
धेरै धेरै वेजहरू छ अब जस्तै यो माइन्डफुलनेस जुन अहिले आइरहेको छ जुन रिल्याक्सेसन टेक्निक्सहरू जुन अहिले माइन्डफुलनेस बेस्ड सीबीटी भनेर चाहिँ यो कग्निटिभ बिहेभियरल थेरापीहरू छ हैन थेरापी पनि धेरै हामीले औषधिको टाइप्स भने जस्तै थेरापीको पनि धेरै टाइप्सहरू छ किनभने सबै टाइप एउटै टाइप सबैलाई फाप्छ भन्ने छैन त्यसै गरी हामीले चाहिँ यो जुन के भन्छ यो काउन्सिलिङ भनेर भन्ने मात्रै हो तर त्यसमा पनि डिफ्रेन्ट टाइप्स अफ काउन्सिलिङ पनि हुन्छ कि त्यसमा पनि त्यही भएर त्यो एक्सप्लोर गर्नको लागि चाहिँ we have to speak to somebody who is professional, who is sort of specialist in that area, you know. There are sports, exercise, healthy diet, social contacts, you know, so very important.
Thank you. Thank you.
Thank you, Nikki ji. अहिले चाहिँ हामी अब आफ्नो चाहिँ अब सकिन लाग्यो या सकिसकेको र भनौँ हैन 3:15 भइसकेको छ सो प्याकअप गरौँ आजको चाहिँ यो प्रोग्राम सो ओभर टु यु सन्दीप जी
धन्यवाद प्रनिसा जी I just wanted to thank everyone यो वेबिनारमा आइदिनु भएकोमा पासा पुचा गुठी UK लन्डन को तर्फबाट धेरै धेरै धन्यवाद छ अहिले वेबिनार्सहरु हामीले निकै गरिरहेको छौं हाम्रो फेसबुक च्यानलमा जानुभयो भने 2 हप्ता अगाडि फाइनान्शियल प्लानिङ एन्ड अवेयरनेस को वेबिनार पनि गरेका थियौं फेसबुक लाइभ गर्दाखेरि सबै कुरा रेकर्डेड भएको भएर you can always go back and view it again special thanks to Dr. Nikki Shakya very informative content again some people were asking about presentation being shared you can go to Facebook live the whole presentation is there I know I will ask with Nikki ji later if that can be shared to our members but I would say just go to the Facebook live video and you can reuse that content you know whenever you want and lastly I just wanted to say again thank you very much just stay healthy go out for walks it's kind of a joke but it's been I think this month is the happy birthday month because I've been working from home for 1 year so it's difficult work from home got only 1 year birthday manaune bela bhara cha cake katera haina so I think it's going to be difficult until everyone gets vaccinated and the government feels confident of opening up the lockdown and huncha ni our normal life will resume but until then just you know keep going stay positive and feed us back what events do you think you as the community want from us we are brainstorming we want ideas from you as the community त्यति भन्दै again धेरै धेरै शुभया भन्दै प्रनिसा जीलाई यो कार्यक्रम सफल हुन अनुरोध गर्दछु
थ्यांक यू सन्दीप जी as मैले अघि भनिसके हामीले चाहिँ अब एन्डमा पुगिसकेका छौं अनि थ्यांक यू भेरी मच टु हाम्रो डाक्टर निक्की शाक्य जीलाई आफ्नो प्रेजेन्टेसन राखिदिनु भएको फेरि एकचोटी धन्यवाद
थ्यांक यू नमस्ते
अनि सबैजना हाम्रो पार्टिसिपेन्ट दिनु भएकोमा अनि फेसबुकमा लाइभ हेरिराख्नु भएको सम्पूर्ण हाम्रो मेम्बरहरूलाई पनि धेरै धेरै धन्यवाद यसको साथै म चाहिँ के अरूको इन्फर्मेसन यहाँ दिन चाहन्छु भने हाम्रो अब नेक्स्ट विक कमिङ विक भनौँ न सैटरडे 27 अफ फेब्रुअरीमा चाहिँ एउटा योगा सेसन हुन लागेको छ